What has gone wrong?
It's a pleasure, thank you.
With the vaccine rollout in Europe? What has gone wrong?
Well, all resources, they are now focusing on figuring out, well, what has gone wrong? Because indeed, to the level from me, of course, to our president, everyone is focusing on getting the doses out to people who really, really need this. There will be a press conference very, very shortly where all the different details, they will be explained.
Talking about the internal issues at the European level, Commissioner, I'd like to sit there just for a moment. Is this European bureaucracy that has slowed things down, or is this all AstraZeneca in your view?
Well, one thing I can tell you, this is not an issue of bureaucracy. This is an issue of delivery. And I think you can rest assured that my colleagues dealing directly with this, they do everything they can to make sure that the contracts made, that they are being lived up to.
So help me understand this. Why were the contracts made reportedly 3 months after they were agreed at the UK level, at the level in the United States, with the same manufacturer? Question one. And question two, this spat is happening before this drug has even been approved by the European Union, when the UK approved it 1 month ago. What's happening there?
Well, I think I'm as interested in these answers as you are, but this is not, I'm not what we call chef de file. It's my colleague, Stella Kyriadis, who's dealing with this, and she is answering, I think, a number of questions in a press conference that will actually be starting in, I think, 8 minutes.
I look forward to that news conference in 8 minutes. We'll bring the headlines on this programme, but, Commissioner, you did say that this wasn't down to European bureaucracy, but if it's taking longer to approve these drugs, if it took longer to approve these contracts, how can we look past European bureaucratic red tape slowing things down? Surely that's a factor in all of this, Commissioner. Can't we sit here and just acknowledge that as other countries are moving on with the rollout of this vaccine programme in the UK, in the United States, Europe is slowing down. And I think there's a real worry for some people right now that this is eroding faith in the European project. Commissioner, what would you say back to those people now?
Well, of course, one should acknowledge things that are true. But if things are not true, I think it's really important to tell the story as it is. And you can only make the approval for the marketing of vaccines when you have good numbers, when the clinical tests, they are actually backed up by the data to show that this is a safe vaccine. Because people need to know that the question of approving a vaccine is not a question of bureaucracy just turning the wheel. This is a real thing. This is going through the numbers and making sure that this is safe. And we have to vouch for what we're doing here. We have an independent authority as well as in other jurisdictions in the world, and they will have to vouch for the numbers. Because one of the important things, and we've been discussing this for months in Europe, is of course to create the trust in people that these vaccines, they are safe. Because otherwise people will say, no, I better wait. And if people start waiting, once the vaccines become available, well, then we don't get the immunity that we all need in order to move both our economy, but also our society out of this crisis.
It's a really important point, Commissioner, that you're making to address the point that the European Union has taken a whole lot longer to approve these vaccines. What about the earlier point I made, though, that it took an extra 3 months to secure the contracts? And how can European nations right now make the argument that they should have equal access to this vaccine when they were 3 months late compared to the UK and the United States? And I'm not sitting here advocating for the UK or the US right now, Commissioner. I just want to understand the European argument at the moment with the German government pushing the idea that maybe we should stop exports of some of these vaccines going out of the European Union. What's the argument when the EU secured a contract 3 months later, and you are the competition chief as well, the antitrust chief, Commissioner, and I just wonder how we answer that question at the European level at the moment.
Well, it's not necessarily just a question of when the contracts they were finalized, because the finalization of the contract was in order to be able for member states to place their orders. And their orders have been placed for a very, very, very long time. we have concluded the same kind of contracts now with a number of people developing, a number of companies developing vaccines in order to be able to vouch towards the European citizens that no matter who is first, vaccines will be delivered. That is the nature of all the contracts that has been concluded. And what I think is important is that now when the CEO of the company in question is being very, very open about how he sees the contract, that he, of course, is willing to discuss it also with us, because the transparency of this process is, of course, the most important thing. And this is why I think for the next hours, a lot more detail will be put out in a transparent way for people to be able to judge themselves.
We look forward to receiving that detail.
And the second thing is that
please do, carry on, please
these are giant companies. And what we need is, of course, that you can conclude this kind of contract. And I think one thing is a given, and it is that no individual member state could have done the same thing as we have done in common, because the strength of the European response is the fact that we do this in common, and that ministers of health and heads of state and government, that they come together and say, of course, we have a contract, we want things delivered.